Hi everyone, we're back with another Wellness Wednesday episode, and we will continue from where we left off with diabetes. As a quick recap, there are two types of diabetes. Type 1 diabetes, which is when your pancreas doesn't produce enough insulin, and diabetes type 2, which is when your pancreas does produce enough insulin, but the insulin isn't as effective as it should be. Both types of diabetes are when the blood contains too much glucose, or the fuel that the cells can use. This can cause a wide variety of negative symptoms and that are related to the illness, so it is important to treat or prevent diabetes. When diagnosed with diabetes, trying to stay healthy is a balancing act of sorts. To ensure a proper health, a diabetic person has to stay between hyperglycemia, which is too much glucose in the blood, and hypoglycemia, which is too little glucose in the blood. Hyperglycemia is when the blood glucose reaches levels higher than 125 mg over dl, and it is caused by not having enough insulin, or other reasons like illness, stress, or even a growth spurt or hormones. Hypoglycemia is when the blood sugar is lower than 70 mg per dl, and it is caused by taking too much insulin or physical activity. So the means that people with diabetes need to keep their blood sugar between 70 and 125 milligrams per deciliters to remain comfortable and healthy is really important, and it's sort of like a balancing act. If someone starts experiencing hypoglycemia, then they will feel weak, experience sweating, shaking, have trouble walking and seeing and be disoriented, and have many issues concentrating. And they may feel hungry, anxious, irritable, nauseous, and suffer from seizures. And if you see someone experiencing a seizure, try to determine if they have diabetes, and if they do, they should be treated with a dose of glucagon turned onto their side, and then have 911 and their caregivers alerted. If someone is hyperglycemic, then they will experience thirst, urinate frequently, have blurry vision, feel hungry, could start experiencing ketoacidosis, or when too many ketones try to act as a replacement fuel for glucose, cause the blood to become acidic. So how can you treat diabetes and stay within the healthy blood glucose range of 70 to 125 milligrams per deciliters? Well, diabetes is typically treated by using insulin injections done with an insulin pen or an insulin pump to increase blood insulin levels, allowing for greater amounts of glucose to be moved out of the bloodstream and into the cells. Another vital part is lifestyle changes such as exercising and going on a diet to help ensure the blood glucose values remain in a safe range. Type 1 diabetes can also be alleviated by implanting other pancreas cells from a non-diabetic patient into someone to allow for more insulin production. A potential cure for type 1 diabetes is also in the works, but it is still very far off. Cell therapy is the process of encouraging the creation of more insulin-producing pancreas cells with things like embryonic stem cells, hormones, and nutrients. In the future, this could potentially be a sort of a cure for patients with type 1 diabetes. Type 2 diabetes can be managed by controlling blood glucose, blood pressure, cholesterol, and by maintaining lifestyle changes, which is also very, very important to managing type 2 diabetes. These things include things like eating healthier, going on a diet, limiting calories if overweight, and being physically active, and taking the prescribed medication. Since type 2 diabetes is something that develops over time, you can also act to prevent type 2 diabetes by losing weight if you are overweight, or if you are healthy, ensuring that you do not gain too much weight by consistently exercising and by eating healthier in general. However, due to the lack of options diabetic patients would have when it comes to treating their disease, the complete absence of any real cures, the difficulty of enacting lifestyle changes, and the adverse reactions associated with some of the treatments, people with diabetes are very prone to using complementary or alternative medicine. The most common complementary or alternative medicine used in relation to diabetes are neuropathic medicines. Neuropathic medicines are those that emphasize using products that are closer to being natural, like cinnamon, garlic, fenugreek, and vitamin supplements. The National Institute of Health have found that any of those neuropathic products mentioned to help with diabetes, except for chromium supplements, which have been shown to help with blood sugar control. But the evidence to support a scientific endorsement of the effectiveness of many of these treatments is unsatisfactory. Most of the complementary or alternative therapies mentioned above do provide positive results outside of diabetes, but they need to be utilized cautiously. Another concern is that utilizing complementary or alternative medicine can encourage stopping conventional medicine, which can be very, very dangerous. Hence, it is incredibly important that when using complementary or alternative medicine, a primary care provider should first be consulted. Always inform your primary care provider about any treatments that may impact your health to make sure it is safe. If you would like to know more about diabetes, then you can visit beyondtype1.org, beyondtype2.org, www.diabetes.org, and www.jdrf.org. You can also visit the CDC's National Diabetes Prevention Program website. Thank you for watching our Wellness Wednesday video today. We hope you learned a lot about diabetes and how to prevent type 2 diabetes, how to manage both forms of diabetes, and how complementary and alternative therapies interact with diabetes. Have a great week. Bye.